Hi, Dr. Brian Kaufman here, Chief Medical Officer, Executive Vice President, co-founder of the CLL Society. Dr. Parikh?
Hi, nice to see you again, Dr. Kaufman. My name is Parikh. I'm a hematologist at Mayo Clinic in Rochester, Minnesota. Nice to be here.
Dr. Parikh, there are some excellent medications available, antivirals, to treat COVID-19. They're in terribly short supply as we're speaking right now. And the main one that seems to be the most helpful is Paxlovid, but there's a problem for CLL patients. Can you explain what that problem is, what the cautions are, and how you at Mayo are addressing that, and what patients should talk to their own physicians about?
Yeah, no, I think that's a very important question and a timely question. Thank you for bringing it up. I think, as you very well pointed out, unfortunately, these medications are not very easily available, at least now, in early January 2022, but we sure hope that that will change over the course of the next several weeks to months. I think one of the important things that our patients need to remember is that these medications have what is called as drug-drug interactions, meaning the metabolism of the contents of Paxlovid can interact with the medications that our CLL patients take, in particular, medications such as BTK inhibitors like ibrutinib, acalabrutinib, or zanubrutinib, and BCL2 inhibitors such as venetoclax. And because of these drug-drug interactions, the levels of CLL medications can actually increase in the body of our patients that take the COVID-19 pills. And therefore, the recommendations from our colleagues here in pharmacy are that if you are prescribed one of these medications, the Paxlovid in particular, to treat COVID-19 as an outpatient, you should temporarily stop taking your CLL medications for about 5 to 7 days. You should obviously consult your hematologist about this and make sure that they're in agreement with the plan. But this would be a general recommendation for most patients who are taking one of these CLL medications.
Is there a danger to the patient who has CLL to stop their medicine for 5 to 7 days?
In most cases, no. I think we have seen many of our patients who are on these medications for several months to years who stop it temporarily for a variety of procedures, et cetera, and nothing happens. In a small proportion of patients, about 5% or so, we have seen patients describing worsening disease, including worsening lymph node enlargement, some fatigue, some night sweats that can return when they temporarily stop these medications. And if that were to happen, I think, again, talking to your hematologist and oncologist would be the correct thing to do. In most instances, we either ask the patient to start a lower dose of that medication, such as a third of the usual ibrutinib dose at 140 milligrams a day, et cetera, or consider the use of prednisone to suppress the lymph node enlargement. I think it's important to remember that in the context of COVID-19 infection, we would not advise the use of prednisone because it can actually lead to worsening of the underlying COVID-19 infection. And so I think in such situations, perhaps considering a lower dose of ibrutinib or other medications that you have held, while accepting the slightly higher risk of interaction, the drug-drug interaction that we are worried about, would probably be a reasonable trade-off.
Well, this is an important thing for patients to consider, and hopefully they'll have the option to consider it if they do come down with COVID by increased availability of these potentially life-saving drugs. Thank you for your insights into this. Thanks so much.
Yep, thank you for having me.